So, my name is Benita Gill, and I am going to talk about the paper or the research article that our professor asked us to look up in regards to our class. My class is CRIJ5313, and it is going to be about the somatic outcomes research for corrections based treatment from the criminal justice Kentucky treatment outcome study. So that is what my discussion will be about in the next 14 minutes. So, and overall, of the last 4 years, the Kentucky correctional system has expanded the corrections based off the modified therapeutic community treatment from 6 programs to 24 programs. That's really good. The ex- uh, the effectiveness of these programs was based off this specific Kentucky treatment outcome study. So this is something that we're gonna dig a little deeper in regards to this article. So the data that's reported on this specific study is from the Criminal Justice Kentucky Treatment Outcome Study, a project that was actually funded by the Kentucky Department of Corrections. So they put a lot of funds in this in regards to making sure that they had the programs for individuals who was incarcerated in regards to how were they doing once they have been released from prison and they're embedded in these programs, and you can see the success rate of this specific article. And it was so interesting because in this article it really goes over and it details the clinical assessments data, and it shows you like the baseline of this specific data from the Kentucky treatment outcome study. It follows up with interviews 12 months post release from incarceration, are conducted by the university research team, and they do random sample treatment program with participants. That's volunteer, of course. The corrections based substance abuse treatment currently is being used in Kentucky, as well as treatment outcome data for about 700 offenders who completed the prison or jail based treatment 1 year after release using this data collection approach. Now, this shows a whole lot in regards to what's going on in this specific paper. Now, the findings of this specific article and the program that they have embedded in Kentucky, it shows the percentage of the jails and the prison treatment participants reporting any substance use following release from custody. It shows how the numbers followed had been way lower, so 43.9% compared to the baseline of 94.1%. That's really good when you're having individuals that have used drugs and alcohol, and since this program has been embedded, these individuals are coming back and getting the help that they need. The success rate of this study shows in its numbers. And it says additionally, the few differences in substance use of a follow up between offenders and who participated in the community aftercare compared to those who did not. But those offenders who participated in the treatment reduced rates of recidivism, excuse me, at 1 year post release. So that's really good. Under 1 year post release, they're still doing great. They're not being back in the system in prison. They're not using drugs and alcohol. So this it shows positive outcomes have came about with the Kentucky correctional substance abuse treatment program. It provided so much systematic data of the collection of the approach and how they evaluated the correctional treatment programs and some of the key factors. It just showed on how this actually works when something is put in place to help these individuals overcome drug and alcohol use. is to participate in these type of programs that help them counseling, inpatient, outpatient services that helps these individuals understand um, their addiction, understand the disease that they had, um, especially if they was heavy users. This data is very important. It's very good, and it's a testimony to that. The outcome studies focus on the drug use, the following up the participation in corrections based off substance abuse treatment programs and documents success over the last 2 decades. So it speaks really volumes. It was reported it had reduced the drug use and recidivism of individuals, even just like I said, coming back in. It didn't have the revolving door aspect, as I have always stated in some of my other posts, in regards to some of the lessons that we had to cover within the correctional system. The evaluations are designed, and the methods are designed for the actual university and the correctional team to make sure that they're getting the best that they need out of the program to be able to fit the need of that individual that is actually participating in the program. So the participants between correctional based treatment providers, the administration team, the university based research team, they provide data from the first 2 years of follow up findings that describes in the Kentucky correctional based substance abuse treatment outcomes using this specific approach. And it's good to have recent data, it's good to have current data, and actually individuals that are willing to, change their life around and to show that programs that are embedded into helping individuals not go through a relapse is very needed, because in a society now where they want to see the data, they want to see the facts, they want to see if this program works, if it sticks, so they can maybe share the program with others of their success rate, and it can be a domino effect around the world in regards to getting a successful program out in the communities to help individuals who are dealing with drugs and alcohol. This program also it reduces drugs use and recidivism. Um, it shows the approach of how they collected the data, how it was evaluated, the benefits, of the program, systematic approach using this specific data. One state corrections-based substance abuse treatment programs, that they use. It showed that doing the therapeutic communities in jails and prisons convincing reduce drug use by following this specific release, based off this specific study and treatment, especially when it was combined with aftercare and the treatment in the community. And that's what's important. When individuals are being released from prison, it needs to be an aftercare approach to these individuals that are about to be released. They need some type of help, especially if they was incarcerated and their incarceration was because of drug abuse, and heavy using and also selling. This therapeutic approach, once they are released, helps them get the help that they need, help them go back to their community to give their community help by having these resources out there and having this data and these numbers that shows that this program actually works. This program has lower drop rates. I had mentioned, early in the presentation of the percentage rate. What's so important about this, when offenders who did not participate in this therapeutic community were compared with program dropouts, program graduates, and program grads who was also attended aftercare. Those participants in treatment groups was up to 15 to 20 times more likely to remain drug free for 12 months follow up. And that's really good to be drug free for a 12 months follow up, because they decided to continue this program in regards to getting the help that they do need. So that speaks volumes. It also talks about the reported of overall outcome on who completed in in prison treatment followed by community aftercare where they're least likely to have engaged in drug use. So once they're getting the information that they need in the prison system in regards to the counseling and substance abuse counseling and therapeutic counseling that they're receiving, once they are released and they receive that aftercare, they're less likely to use again or be involved. They're more than likely going to go to groups, or they can one day be sponsors. They can go to the AA meetings, Alcohol Anonymous, NA meetings, Narcotics Anonymous. These are just great things that these individuals can do, and how they can engage with other brothers and sisters who's dealing with substance abuse. It also talks about how drug free follow up after 42 months and 60 months after prison released also was embedded in this specific data. The study showed that participants in prison based in regards to the therapeutic community program was over 4 times more likely to stay drug free for 42 months post release compared to the non treated control group. In addition, treatment participants was more than 3 times more likely than to control group to drug free for 60 months post release. So getting this information early and in advance before their release, then you can see how it shows in numbers how these individuals are staying off of drugs for a long period of time, and they're getting the help they need because they're also having aftercare. So they're getting connected with individuals that's out here in the community in regards to making sure they stay clean, and make sure they stay sober, and make sure they stay out of jail or out of prison. It talks about how Texas was less likely than dropouts to be rearrested within 6 months. So individuals that did not want to be involved in a program to help them in regards to their substance abuse, Texas had a rate of less than dropouts of 6 months. You had California did the same study, reported similarities, 5 year outcome study with a smaller percentage treatment group being reincarcerated than control group. So sometimes you might not have anyone maybe perhaps do drugs again, but then they get reincarcerated. Maybe based off other additives. It talks about even therapeutic community treatment and how promising it is in regards to this specific study. The Kentucky Department of Corrections expanded treatment between 2005 to 2008. 6 prison programs increased from 4 programs, excuse me, and 18 regional jail programs increased from 2 programs. So you can see how it just started spreading like wildfire in regards to how much this was very beneficial for them. Their partnership was the Correction Department of Corrections, the Kentucky Division of Mental Health, Substance Abuse, the University of Kentucky to develop the Criminal Justice Kentucky Treatment Outcome Study. So a lot of hands on deck in regards to making sure that this baseline it decreases. It also has where it shows that federal and state funding money was embedded also in this Kentucky treatment outcome study that was very helpful and beneficial for them. Looking at the behaviors and monitoring them electronically, whether they did it by maybe diary, maybe they did it also according to the article by telephone, by voice response. Some of them had face to face clinician interviews. So a lot of great things happen in regards to getting them the help that they need for the university to continue to do their research to provide an ongoing reports and getting that feedback that they need for the correctional administrators, for the treatment providers, to make sure they're summarizing this data in regards to getting it out statewide to help other individuals know that this actually does work. And just to see the rate of it go down within 6 to 9 months, doing 30-minute interviews in regards to getting these individuals the help that they need. Very good article to read, and I encourage you to read this article to help your community as well. Thank you.